what's true about Huntington's as well as other neurodegenerative diseases is these are very complicated diseases. Now, in Huntington's, we think we know what the deficit is, right, based on the genetic linkage. And a lot of the strategies to date have been focused on mitigating the effects of mutant Huntington. Now, the challenge is that we haven't seen that treatment paradigm fully pan out yet in terms of clinical outcomes. But it's also the case that all of these terrible diseases are likely going to need multiple approaches, whether we're talking about Huntington's, Parkinson's, Alzheimer's disease. What we're really focused on at Sage is interventions that are readily apparent in their outcomes to patients, right? If you can take a drug and see an effect in the course of a few weeks or the course of a month, that's really what we're going for, because that really reflects the unmet need for patients. And so the unique approach, in addition to the mechanism, there are not other programs in development working via NMDA positive modulation for Huntington's, but really the focus on cognition in Huntington's, which has historically not been the most prominent aspect of the disease, at least when you look at the academic literature. When you speak to patients, when you talk to families, you understand that cognitive impairment, cognitive changes very quickly early in the disease impact ability to maintain independence. Those are the things that cause patients to lose the ability to work, lose the ability to drive. And so we feel very strongly that this is going to be an important treatment approach. When we kind of look to a future state, there may be multiple approaches that work for patients. But if we can help to improve cognition acutely and sustain that improvement, we think that will have some meaningful effects for patients and their families.